Hello, everyone, and welcome. I'm Sharon Alamopodii. Thank you so much for joining us today. We are thrilled to have you here for what promises to be an incredibly insightful and valuable session. Today, we are going to dive into the topic that is crucial to the success of every practice: operational clarity. You might be managing a growing team, you might be scaling operations, or just looking to streamline your processes. Gaining clarity about how your operations work is essential to driving efficiency, reducing friction, and unlocking potential. I am very excited to have Mandy Cancer join us today. She is a consultant on our team, and her areas of expertise include not just clinical training, but also organizational optimization and leadership training. And you can see our other trainers are listed here. We have a really great team of consultants, and they all have different areas of expertise. So we basically cover everything you might need training in. I am so excited to have Mandy join us today for the next 3 webinars to guide us through this vital subject. So today is the first in a series of 4 webinars. Our special guest, Mandy, is a seasoned expert in operational strategy and process optimization. She has years of experience helping organizations just like yours of all sizes achieve clarity, scale effectively, and really run like well-oiled machines. She's going to be sharing actionable insights with you and proven strategies that you can take back to your own organization to help simplify complexities and build stronger and more sustainable operations. So get ready to gain some valuable tools and perspectives to transform how you approach your business operations. And we are confident you'll walk away with new ideas and new strategies that you can implement right away. If you have any questions you'd like to ask Mandy during this webinar, please use the chat feature for that. And please join me in welcoming Mandy Cancer to the webinar. Welcome, Mandy.
Thank you so much for that introduction, Sharon, and hello to all of you. Thank you for taking some time out of your very hectic days to join us. I hope that after this, you're able to walk away with a few more tools in your tool belt that's going to help you just really be successful this year. The new year is such a great time to regroup and to start anew. It's a time to look at where you want to go as a practice in 2025 and then figure out how are you going to get there. You may be able to meet your needs in-house, or you may need to pull in an expert to help you get where you want to go. Either way, we're presenting this webinar series to get you in the frame of mind of continual improvement starting now. This is the first in our New Year series on operational clarity. As Sharon has already shared, over the next 4 months, we will explore various topics related to operations and provide insights into how to position your practice to thrive in 2025. These webinars are going to be live. Our first session today is going to be on the hidden cost of inefficiencies. In February, we will share insights on streamlining patient flow. In March, we will touch on metrics that are vital to measure in your practice. And in April, we will wrap up the series by discussing how to position your practice for future success. Effective time management in ophthalmology is not a light topic. Efficiency or lack thereof impacts our organizations. It's crucial for providing exceptional patient care, being an employer of choice, and being financially successful. Addressing inefficiencies in your practice is vital. Not only do inefficiencies negatively impact patient care and experience, but also staff morale and the practice's bottom line. Let's take a look at a few ways inefficiencies in the practice can hurt both cost, staff morale, and the success of your practice. There are many factors that can contribute to inefficiencies in operations. However, for the purpose of our time together today, we're going to focus on 3 things that can really impact your practice if you choose to focus on these areas. Some of them, I wouldn't say necessarily the easiest areas, but definitely some of the more simpler topics to focus on, to really start thinking at the beginning of the year, how quickly can you move the needle to be in a positive direction? If you're struggling, identify that you're struggling in any of these areas. So the first is repetitive work or processes. Are you doing redundant work, or is there redundant processes? Utilization of schedules, whether it be that it's overbooking of the schedules or maybe underutilization. And inconsistent workflows or lack of a solid training plan. Redundant documentation takes up more time than what we realize. Over the last couple of decades, the adoption of EMR really transformed documentation in healthcare. Think about it. For those of you who have been on EHR for a while, you remember the days when you were on paper chart, and every time the patient came in, you had to bring everything forward every time. Well, most practices have moved towards an EHR, or at least are fairly new in an EHR. Some practices in the last year or two are still getting accustomed to that new workflow. However, we have to think about, even though we're using technology now, oftentimes that information does come forward. It lives there once it's documented in a grid or in a template. However, there's still a lot of redundancy that takes place in healthcare and things being documented in multiple places. Consider the patient journey and all the touch points for communication and documentation. When we think about the patient journey, the patient may call into the office to schedule an appointment with someone, or they may schedule online. There may be a pre-registration process that's in place of all of the checks that they go through before they get to our office, and then the check-in process, and then the intake process with the technician, and then the time with the physician and the scribe during the examination. And then there may be testing after that, or surgery scheduling, maybe a trip to optical before going to checkout. In all of these places, patients are giving us information. And how many times do we hear from the patient, well, I already filled that out before I got here, or I already told that person, I've already been asked that. So being sure that our technology really works for us when we're in EHR, being sure that fields carry forward and that we're not repeating, we're using good utilization of our time, which will also give the patient the confidence that when they give you the information, that it lives somewhere and it was worth their time. So do you require patients to fill out the same forms multiple times, maybe online, on paper, and again in person? Now, here is a really shocking factor. I just recently learned that in 2019, the KCI Institute did a study that included 48 eye care providers and discovered that redundancy in chart documentation and ophthalmology alone ranged from 30% to 75%. Wow, how much time? If we were to measure that in time, think about that. Data speaks volumes. So that was a very surprising number for me. So maybe it's that staff are spending excessive time reconciling patient information, maybe from paper to EHR, or maybe they're entering the same verbiage in every time in the clinic throughout the day. For example, let's say we have a comprehensive doctor that goes into the room to see a patient and is going to offer cataract surgery. So they're going to talk through what the risks and the benefits are. They're going to talk about maybe what the options are for the patient in terms of IOL options. However, these talks are fairly the same every time outside of what the options are for each patient. When we're using technology, there's skills, there are options for quick plans or for phrases that are built in that all you have to do is click it and it will save several paragraphs or several sentences, and then you can customize from there. So being sure that you're leveraging the technology to work smarter, not harder. And this will really help as well the time that you're able to spend with that patient, to give them eye contact, to give them your attention, to answer questions, for the physician to be able to spend that time. because we have done our part in making that process more efficient so that we can make the patient experience better. So what is the impact? Well, the impact of redundant and manual documentation is wasted staff time that could be spent on higher value tasks, increased risk of errors such as billing mistakes or maybe misfiled patient information, which can lead to claim denials and compliance issues. Repetitive documentation creates a slower check-in process. It can slow down the clinical history intake with the technician, can increase the patient chair time with the physician, which ultimately leads to delays and frustrations for both patients and staff. When you think about a patient being frustrated before they even get to the physician due to a bottleneck at whatever part of their journey before they end up in the chair with the physician, oftentimes physicians are having to diffuse a patient or say, I'm sorry that you had that experience before they can even start their exam. When we're frustrated as a patient, we're not nearly as open to hear what is that treatment plan and walk away with the information that is needed for a good quality visit. Inefficiencies in scheduling are among the most common challenges in ophthalmic practices. We all experience it. Think about overbooking in the schedule, which creates a bottleneck in the clinic, leading to longer wait times and frustrated patients. Do you have a system in place in your practice to not allow overbooking? Or maybe a protocol in place that overbooking can only be done by certain positions. Maybe it's the lead person for the call center or a triage person, or it is a combination of someone in the call center speaking to a lead technician of a team. If you don't have a system in place, now's the time to be thinking about that, as well as, do you have physician templates that are built in? A practice without a template where call centers have to memorize what to put, where to put it, does not allow them to be successful. And then that lands in the clinic with how does it flow in the clinic when patients are not scheduled in the appropriate slots. If we have to build these templates, thinking about the efficiency of the provider as well. I'm sure as administrators, if you've been in your position for any length of time in the practice that you're currently in, you probably know off the top of your head who are the physicians that are more efficient than others. It oftentimes has to do with the way that that physician practices medicine or the complexity of that clinic. Is it a comprehensive clinic? Is it an optometric clinic? Is it a retina clinic or an oculoplastics clinic that has lots of consultations? And so really understanding what type of template needs to be in place to ensure that there is going to be a seamless patient flow. Now, the opposite of overbooking and bottlenecking the schedule could be underutilization of appointment slots. So sometimes it happens that for whatever reason, that no-shows can creep up over a few months, that there's a pattern of a higher percentage for no-show rates, or maybe last-minute cancellations in the schedule, leaving empty places. And for practices that are high volume, sometimes we're booked out for months, right? Well, there needs to be a contingency plan in place. If we see that there is a pattern of no-shows or a pattern of last-minute cancellations, what can you do proactively to put a resource in place or a plan in place of how to offset what that is over that period of time? When there are empty slots on the schedule, then patient care is being delayed for patients that are waiting months in advance that could be proactively being moved forward or offered sooner appointments. How well are you using the square footage of your facility? When you think about the flow in the clinic, where the diagnostic equipment is, maybe where the surgery scheduler is located, where pieces of what the technician needs to be successful in that clinic, when they're having to walk steps to the other side of the building or backtrack multiple times with patients, sometimes we have to rethink about where are things located and thinking about moving them around to make it flow better. Disorganized room assignments or bottlenecks in the use of equipment can really slow down the patient flow. Well, what's the impact for scheduling and patient flow bottlenecks? Well, patient dissatisfaction, which equals poor reviews online, and word of mouth, which travels quickly. You think about how most people, is human nature, are more vocal if they have a negative experience or a negative review. And all it takes is one or two negative reviews to really offset some of those positive reviews that our practice has worked so hard to achieve. When there's increased patient complaints, that means that our resources, our administrators or coordinators, whoever it is that's fielding those complaints, has to spend time to listen to them, to diffuse, to troubleshoot, address what that situation is, and how to make it better going forward. Ultimately, patients can leave our practice. Sometimes patients don't go online and voice their opinion. Sometimes patients don't call us. You need to have a process in place that when patients do share with you what their experience is, if it's less than positive, thank them. Thank them for giving you that feedback. Because for every patient that puts an online review that's negative, there's a patient who's not willing to share what their experience was. And those are the silent reviews. They're going to tell the people they're comfortable telling, but they're not going to put it out there. So we really have to think about how these can build into the stress level. It can also tank staff morale. When there's increased chaos and tension and frustrated patients and bottlenecks in the clinic because of an inability to be able to maintain the schedules, then that shows up in the culture of what our team members feel like throughout their day at work, which ultimately can lead to lost revenue from staff turnover and from loss of patients. This topic is in Sharon's wheelhouse. Sharon, would you like to take over on this one?
Thanks, Mandy. Yeah, let's talk about training and why is it important to standardize training in all areas of your practice? Firstly, it ensures consistent quality of care across different healthcare providers because you're establishing clear guidelines and protocols. Ultimately, this will lead to improved patient safety, reduce medical errors, and will provide you with the ability to compare data and best practices across institutions and practices and offices. Essentially, it provides a foundation for delivering high quality, evidence-based care to patients, whether they received care from you or somewhere else. So some of the key reasons why standardization in medical training is important include patient safety. By defining standard procedures and practices, the risk of errors due to variations in care delivery is minimized, and this leads to better patient outcomes. Standardization allows for easier identification of areas for improvement through data analysis. This improves the quality of care and enables healthcare providers to continuously enhance their practices. Communication efficiency is important. Clear communication between healthcare professionals is critical for coordinated care. Professional mobility. When training follows standardized guidelines, healthcare providers can readily transition between your offices with a consistent understanding of procedures. Research validity. Standardized data collection methods enable meaningful comparisons of research findings across different studies and healthcare systems. And finally, cost effectiveness. By reducing unnecessary variations in practice, standardizations can contribute to more efficient use of resources and cost savings. Important aspects of medical training standardization include clinical guidelines. So these are evidence-based protocols and practice guidelines for common conditions. This is also known as best practices or practices of the doctors follow the best practices as set forth by the AAO. Curriculum design. So you should have a consistent structured program and the content should be the same across all of your practice and reproducible, I might add. Assessment methods. So standardized testing and evaluation tools are very important to ensure that they have retained what they've learned and they're applying it and to ensure competency. Terminology must be standardized as well. Using consistent medical terminology will avoid misinterpretations, which could be a problem medical legally. Mandy?
Yes. Operational inefficiencies create a ripple effect across the practice. Patient experience in terms of longer wait times, errors, and inconsistencies in processes lead to dissatisfaction, negative reviews, and lower retention rates for our patients. When you look at this picture here, this image that we have, it shows kind of the ripple effect of inefficiencies, and it just kind of trickles all the way down as it impacts the bottom line. Staff performance in terms of burnout, frustration, high turnover creates additional challenges. We know that high turnover can definitely, our teams, any practice that we talk to, and ophthalmology is a fairly small world. For those of us that have been in it a while, we know a lot of administrators in our network, and when turnover increases, morale decreases, and we feel that as leaders. That's really hard. Whenever we have someone who's trained and they're dependable and they leave, it's really hard to replace all of that knowledge. It takes a period of time to learn that. And so decreasing staff turnover is huge, but we have to be able to understand what leads to staff turnover. And oftentimes it's burnout, frustration, and just being overworked in certain areas because of inefficiencies. All of these things compound operational success, which ultimately leads to decreased profitability when there are lots of inefficiencies, loss of revenue from missed appointments, inefficient workflows, and claim denials. It all adds up over time, affecting the bottom line. Identifying and addressing these inefficiencies is critical to ensure smooth operations, happy patients, and a thriving practice. Identifying operational inefficiencies in advance and putting a plan in place to mitigate them will ensure that your patients receive the experience that they deserve. It will also create a positive culture for your teams and make your practice financially successful for years to come. I can't stress enough the importance of being proactive in identifying what these areas are. Happy patients are important, but it doesn't just start with, did they have a good visit with the doctor? When we have inefficiencies in place that create stress and tension on our team, then it impacts the experience of our team members. And that the impact to our team members, whether it be positive or negative, trickles over into the patient experience. It's all one big puzzle. And if one piece is missing, they all start to shift because there's nothing to hold them in place. Think about when you've been to a grocery store or the dentist office or even a retail store, whatever it is, when you can tell when someone is happy at their job or if they're just waiting to ride that clock until the time is over. And we feel that as well whenever we go through bouts of stress in our own jobs. And so it's really important that culture that we create and identifying what those are, because the patient experience doesn't happen just between the patient and the physician. It's all of the other steps along the way in that journey before the patient makes it to the physician. When we think about being an employer of choice, which means that we're going to, our team is happy enough where they are that they would share it with other people. They're going to recruit other people. They're going to say, hey, you should come work here because we have great benefits and our physicians and our leadership really care about us. Those are things that are important as well. And so being sure that that environment and that culture is a positive feeling takes intentionality to put all of these things in place. When we do the right thing for the patient and we pay attention to all of these processes to work smarter, not harder, and to be efficient, then the profitability comes. When we make the right decisions, we input the right processes, the right protocols, we have the right culture and motivation behind that, we will thrive as a practice, and your practice can grow and be financially successful for years to come. So this was just a few tools for the purposes of operational inefficiency that we hope that you can add to your tool belt, which is going to be a building block for some of the upcoming webinars that we're going to be sharing with you in a few short weeks. Sharon, do you want to speak to that?
Yes, thanks, Mandy. Great information. So February 6th, our webinar will be about streamlining patient flow. March 13th will be the metrics that you should be tracking as a practice. And April 10th, we'll discuss preparing for the future of ophthalmic practice management. If you'd like to contact us, there's a bunch of ways to reach us. They're listed here. Today's webinar was recorded, so if you would like to recommend that a colleague watch it, it will be available within 48 hours on our website, which is itechtraining.com/webinars. Our next webinar will be streamlining patient flow. Mandy will be joining us again. It will be February 6th at 2 p.m. East. Thanks everybody for joining us today.